Thank you, Judy. Thank you. That was very nice. And being back on the Hill brings back lots of good memories. I served on the Senate side for about 10 years. I was chief of staff for Bob Kerrey from Nebraska and later Bill Nelson from Florida. So it's always nice to be back up here. And this is especially great being with so many remarkable women. It's always walking into a room like this that, brings back all those memories of working together on a campaign. And this is a campaign, and it's just such an honor to be with you today. And I'd like to also especially thank Mema and the work that she's doing in founding and continuing to work with the Tiger Lily Foundation. And also, I really enjoyed talking to Joan before we started today, and again, really talking about the community of women that most of the folks in this room are part of, but on how women can help each other, how we can get together, solve a problem. And I thought, Joan, what you mentioned earlier about the platform that you're starting, women have questions. What should I do? This just happened. And how quickly other women respond and answer. And I think that's what it's all about, women helping each other get through these kind of challenges and continuing to then also work on the policy side for research dollars. And I saw just today in the Washington Post another story about some impacts on DTT on women and breast cancer. So the news is changing all the time, and we really need to keep up with that and take that into account as we make policy. So thank you both, really, for having me here today. And thank you, everyone, for all the work you're doing. As Judy mentioned already, breast cancer remains the second leading cause of cancer-related deaths among women, and this year alone, nearly 250,000 women will be diagnosed. And many, as Judy mentioned, are under 45. So obviously, early education, empowerment, and awareness is so important in being able to save lives. And all of us are here today because this battle is personal. I'm a mom. I have 2 teenage daughters. That is a challenge in itself, but one's in high school, one's in college, and I know that this disease is indiscriminate. It affects women of all ages, races, and financial status. And while a family history of the disease can increase your chances of developing breast cancer, the majority of breast cancer occur in women without a family history, as Nakia was just mentioning. So it is our responsibility as mothers, sisters, leaders, and friends to empower our loved ones to make sure they are well educated and have access to the insurance and the health care that they need. I think she's not here yet, but thanks to the relentless work of Congresswoman Debbie Wasserman Schultz, the EARLY Act was included in the Affordable Care Act and is ensuring women have the best information and resources available to fight against breast cancer. Not only is Debbie a survivor, but she's an inspiration to all of us in this field. For the past 2 years, I've had the privilege to work for another breast health awareness champion, Dr. Jill Biden. As many of you know, in 1993, Dr. Biden launched the Biden Breast Health Initiative in Delaware to educate tens of thousands of high school girls on the importance of early detection of breast cancer. And we've heard today that can make such a difference in the lives of women and young girls. As Second Lady, Dr. Biden has used her role to raise awareness beyond Delaware and across the country. And each October, we host a reception at the Vice President's residence. We recognize and honor the survivors, but their families, their caregivers, and really unsung heroes who give survivors the strength they need to keep fighting. We have really, I was telling Joan earlier, really interesting people that we've had there, people from all walks of lives that you might not be expecting. We had last year a man named Vinny, who's a tattoo artist, and he helps women with reconstruction and nipples. And he's had a whole practice of that now. And he told us he was about to give it up. And then his sister was diagnosed with breast cancer. And he then decided he wasn't giving it up. And he's been able to provide a lot of women with an important service. And so really, you run across people in all walks of lives that do what they do and use their skills to help. And every year, I'm really moved by the resilience of every survivor that I meet. 2 years ago, I invited a former colleague of mine from Capitol Hill to one of these receptions. She is now a breast cancer survivor, but she noticed a discoloration on her breast but didn't feel a lump. But she took it seriously. It was different than what she had seen before, and she had it examined quickly, so she was able to get treatment that saved her lives. But since then, she's made it her mission to let women know they should see a doctor if they notice any abnormality, not stuff that you've always heard about, but anything. And, women know their own bodies, and I think we've heard that today. They should trust and follow their own instincts. Every woman is different, so it is important to speak with your healthcare provider about your risks and the appropriate screenings. And now, thanks to the Affordable Care Act, 55 million women with private health insurance have access to the recommended preventive services, like mammograms and well women visits with no out-of-pocket costs. I am very proud to be part of an administration that since the very beginning has been combating this disease that affects so many women. We have made great strides, but there is still so much work to do. That's why we're here today, to learn more about the tools and resources available to millions of women to empower ourselves and each other. I'd like to conclude with a quote by the former First Lady, Eleanor Roosevelt, who said, "You gain strength, courage, and confidence by every experience in which you really stop to look fear in the face. You must do the thing which you think you cannot do." Given the resources we have today for early detection, treatment, and research, the thing we thought we couldn't do becomes the thing we can and we must do. Keep fighting for our daughters, for our mothers, for our sisters, and for so many others that are affected by breast cancer. Thank you again for all that you are doing. It is truly making a difference. Thank you.